Well, welcome everyone to Your Health Partner, brought to you by Lehigh Valley Hospital Hazleton. Great show for today. We're going to talk about illnesses and great things, you know, viruses, all that good stuff. Joining me is a good friend of mine, Dr. Anthony Valente. It's nice to see you. It's been a while since you've been on the show, but it's nice to see you. Everything going all right?
Sure.
Family in good shape?
Can't complain, Sam. Everybody's good. Thank you.
Now, stupid question, but for those people tuning in, we get a lot of people move into town, and they, you know, healthcare is important to them. And so when we bring doctors on, we like to know a little bit about them. How long have you been a doctor?
Well, I graduated from med school in 1987, so what does that come out to? 37 years?
You want me to do
38 years? I think Nixon was president.
Yeah.
A long time, Sam.
Yeah, so you've been around for a long time.
Been around for a long time, yeah. I've been in Hazleton here since 1991.
So you're a native of the
Yes.
area, the whole bits, which is great. Now, you're Chief Medical Officer. Sounds important.
Well, it all depends which way you look at it. It depends whether you work at the hospital or whether you're my wife. It's a matter of perspective.
Well, let's look at the way you look at the hospital.
I have a lot of responsibilities at the hospital. I like to consider myself the liaison that represents the medical staff at meetings and with administration and other administrators, and representing the clinical end of it. And my main focus at the hospital is with patient quality and patient safety, you know, things like those issues. So they're my real focuses on, you know, the quality that's administered at the hospital, the safety of patients when they come in concerning hospital-acquired infections, falls, things like that.
So you're on top of all of that. Okay.
Yeah, they're my main responsibilities. You know, there's some other things that, you know, fall in there as well. But as far as, you know, if I had to pick, you know, 2 or 3, those would be the top issues. Yep.
What's the best thing about your job?
The best thing about my job is being a doctor. There's nothing else I'd rather do. I can't think of doing anything else. I continue to do it beyond what's called the retirement age, I guess. I'm past retirement age now, but I continue to do it simply because I like to do it. I love to do it, and
Speaking of
want to keep doing it.
You know, you've seen so many things changing throughout the years, okay, in medicine, all right? How do you keep up with what's going on, which is new and exciting?
It's a lot of work. Keeping up is a lot of work. There's a lot of reading, keeping up with journals, not so much textbooks anymore. Sam, one of the things that's really helped me is our affiliation with the network. So now I'm exposed to thousands of other physicians for conferences, just even consult work, going to meetings, things like that. So obviously conferences are a big part of it as well. You know, you can go to a conference within your specialty, but I think mostly interactions with other physicians, keeping up with the literature, that's probably your best bet to stay current.
So today we're going to talk about winter illnesses and injury prevention and treatment, okay? So tell us about some of the virus, which is like 16,000 of them, and illnesses you are seeing and treating at the hospital.
Well, you know, I think there's the 4 that everybody, you know, is probably very familiar with, and that you hear a lot in the media are the 2 flus, A and B, COVID and RSV. What we're seeing is probably the most prevalent virus locally is flu A. Flu B typically comes in a little later, and it usually doesn't give you as big a spike as flu A. Flu A perennially is a much bigger player. Influenza A. There's 2 types. RSV, at least here, peaked a little while ago. RSV is a virus that is a little bit more pathogenic or a little bit more serious in the very, very young, all right, young children, or the elderly, usually with coexisting conditions. People in the middle with RSV usually do pretty well with it. A lot of people will get it.
What is RSV?
RSV is respiratory syncytial virus. It's another respiratory virus that we get. Most people that get it aren't even tested for it, really. They just assume they have another cold. People that get tested for it are people that are a little sicker with it and go seek medical care. They get the test done, and then they test positive for RSV. But as I said, for the average healthy person, RSV typically is not a serious infection. It's the extremes.
How do you treat it?
We don't treat it in adults. We don't treat it. It's just supportive care. You come in and we treat your symptoms. Some people wind up on a ventilator for it, but it's all supportive. There's no antibiotic for adults that treat RSV. Unlike the flu, that we have Tamiflu.
Yeah.
For that, we don't have a drug for RSV. Even like COVID, we do have a drug now.
So that's what you're seeing in the hospital, flu A and B and
mostly,
RSV.
right now, the most prevalent of those four is flu A.
What's flu A?
Flu A is influenza A. It's one of the genotypes of flu. There's typically 2 flu viruses that circulate every season, flu A and flu B, and it basically it's a variation of their genotypes, their structural makeup. And flu A is typically more prevalent than flu B. It usually peaks earlier. And your shot that you get, the flu vaccine, does protect you from both of those, by the way.
Is it seasonal, these flus? I mean, is it the cold weather?
Yes, it's absolutely seasonal, Sam. Locally, our busiest time for flu is typically from around the holidays till late March, early April. Like right now, we're still on the rise for flu A. As I said, flu B is probably just gearing up. COVID, we've had a bit of a background. Even that does peak a little bit more in the winter, but that's been kind of just percolating in the background a little bit. At least around here, staying pretty constant. Nationally, cases are rising again because it's winter. Winter makes people stay in more, makes people gather in houses. The holidays are big spreaders of all these things.
Yeah.
People get together around Thanksgiving and Christmas and New Year's, and so you have the holiday spread where people are gathering, in churches and at their homes, and even just going to, say, sporting events, inside sporting events, basketball games, what have you. So all that stuff takes place in the winter. And that's why all these diseases become more prevalent, because it's just more conducive to their spread.
Do you advise wearing a mask?
Well, I don't think we're going so far as to say, everybody should mask anymore. I think I probably would if I was in a really high-risk group and I was going to be somewhere where there was a prevalent spread. If I was an elderly person with lung disease, for example, or severe heart disease, I probably would, just to be safe. I don't think I would go so far as to say everybody should mask, though. I don't think that's reasonable at this point.
Did the mask have an effect when COVID was going?
Absolutely. I think that was proven pretty well, that masking did have an effect. How much of an effect depended on, the studies were rather difficult to tweeze out, because a lot of that had to do with if everybody masked, if only some people masked, what kind of mask you had on, if you wore the mask correctly, if you wore it all the time. So there were so many variables. But I think across the board you could safely say that the mask did have some impact on it. The exact amount of impact, I think, is difficult to ascertain, though, looking by the studies that were done.
Well, you're talking about the shot.
Mm-hmm.
Okay, well, a lot of people got the COVID shots and got COVID.
Mm-hmm.
What happened?
Nothing. The shot doesn't protect you necessarily from ever getting the disease. The shot was very, very effective of keeping you from dying from the disease. It protected you from getting it, but really protected you from dying the disease. And I'll give you an example of that, Sam. As of 2023, the National Institute, this is a sad statistic if you think about it, but the National Institute of Health estimated that probably 250,000 Americans died because they didn't get vaccinated. In other words, you can statistically look at this and say, if people would have gotten vaccinated, those people that were eligible for the vaccine, if everybody would have gotten it, out of the 1.1 or 1.2 million Americans that died of COVID, 230 to 250,000 died needlessly because of misinformation they garnered, probably from the internet or other guru, about the vaccine, and decided not to get the vaccine. So you had about 250,000 people die that should be alive today because they didn't get the shot.
Well, then you hear the argument, the fact that some people who got the COVID shot then ended up getting different kinds of illnesses, and either this or that, and they blamed it on the COVID shot. Okay, did you have any of that?
Absolutely, and again, a lot of that is purely misinformation that is gathered. If actually, one of the things that I would probably recommend to keep yourself healthy is stay off the internet. Because the internet has no filter.
Yeah.
Anybody with any kind of credential does not post on TikTok So if you're getting this from somebody on TikTok, there's a darn good chance you're getting misinformation. So I would say the first thing to do if you want to stay healthy is don't get your healthcare information from the internet.
Yeah, and that's
unfortunate.
Yeah, well, people Google, I got this, and then they read all the different. Oh my God, I have this and this and this and this, and so
misinformation is rampant.
Yeah, getting back to the viruses. Okay, do you find that one virus appears to be affecting kids over adults, or vice versa?
Well, obviously, as I said, Sam, and it depends again on what you're looking at with kids, because kids are very different. There's a difference between a premature baby, that's a kid, that child is very susceptible to RSV and the complications from it. Okay, a child with some type of an immunosuppression or something, as opposed to a healthy 16-year-old who is, for the most part, like an adult, right? So it's a little bit sketchier because they're so different, and they're physiologically different from the time they're born until they're 16, 17-year-old, but we still call them all children. So it's a little bit difficult to say. But in that age group, they're all susceptible to the same diseases that adults get. Usually children, because they're as a whole healthier, don't get the severe complications that's most of our older folks with concomitant diseases will get, simply because they're otherwise healthy. Now, that said, again, I'm not speaking about children that have chronic health illnesses or immunosuppression or things like that.
The norovirus.
Noro, yes.
What are some of the symptoms?
Well, the one that you're going to hear about the most, or the two you're going to hear about the most, is vomiting and diarrhea. Noro is a gastroenterovirus. Typically, it's a very, very common cause of viral gastroenteritis. The other symptoms that are associated with it are pretty much just what you think from all viruses. Malaise, you feel like you got hit by a truck, you can get a fever, you can get achy. All those, what we call constitutional symptoms, come with norovirus as well. But the predominant symptoms that people, are most visible are vomiting and diarrhea.
Oh. Well, that sounds exciting.
Yeah, it's not nice. I guess if there's any silver lining there, it's typically self-limited, typically lasts for a day or two or three, and then it runs its course and goes away.
Folks, I'm talking with Dr. Anthony Valente, who is the Chief Medical Officer here at Lehigh Valley Hospital Hazleton. We'll be back right after this. Welcome back to Lehigh Valley's Your Health Partner, my friends, is Lehigh Valley Hospital Hazleton, that supports this particular show. Now remember, 24/7, you're going to watch all of our health shows, my friend, also our YouTube channel, and our website has all of our shows. My guest today is Dr. Anthony Valente, who is the Chief Medical Officer here at the Hazleton Hospital. We're talking about illnesses and prevention and treatment for all these terrible things that are happening. We're talking about the norovirus and how it, etc. Now, if someone hasn't had a flu shot, COVID or pneumonia vaccine, can they still get one?
Yes, absolutely.
Even if they haven't had it, okay?
Yes. Short answer is yes.
Will it be effective? Will it help you think?
Absolutely.
Some people are like, I'm a little nervous about getting a flu shot.
Absolutely.
Benyo says, get a flu shot.
Absolutely. Well, listen to Benyo. Yeah. It's that simple. That's a good point, Sam. I think we should all focus on getting our healthcare information from our providers.
People say when you get the flu shot, you get the flu.
Absolutely, 100% incorrect. Okay. That I can tell you. You will not get the flu from the flu shot. That is 100% incorrect. And again, that's probably something you'll hear online somewhere. No, I would listen to Benyo. A flu shot will take several days to a week or so to raise your immunity to the point where you're protected. But there's still enough time left in what we consider flu season around here that I think is certainly a reasonable item to get. The COVID vaccine is always reasonable to get because there's always COVID around. That does follow some seasonal patterns. Is that a free shot? Typically, insurances do cover those shots, yes. They're like all other vaccinations now. That is a little less seasonal, though. It has its peaks now, but you'll find COVID pretty much all year round. The pneumonia shot, I know you mentioned, I don't want to really get into that here because it's a little bit different, and the guidelines on that are much lengthier. But suffice it to say that folks that should get the pneumonia shot, i.e. the ones that meet the criteria to get it, should get it, but I would encourage you to
What are some of the criteria?
Well, age is one of them. Everybody, depends which guideline you follow. Some of the societies say over 65, some say over 50. People under 50, it depends on whether you have concomitant diseases. So really it's a little bit more than I think the scope of what we're talking about here, but I would talk to my healthcare provider about the pneumonia shot, and that's also not administered seasonally either. That's a whole different actor.
So how do you prevent some of these illnesses?
Well, the best way for what we're speaking about, these communicable diseases, which are viral, bacterial diseases are a little less communicable from patient to patient, person to person. So the best way to prevent these is kind of to steer clear of people that have it. If you are sick, to stay away from people. That's another one. We dramatically encourage that at the hospital, that if you're sick, don't come to work. So if you are sick, kind of keep yourself away from people. If you know somebody's sick, don't go near them. Common sense things, hand hygiene, washing your hands constantly during the day, frequently, constantly. Cleaning surfaces at home. And one of the things about norovirus, by the way, is just a pearl for it. It's not killed by hand sanitizers. You got to use good soap and lengthy water and wash. And it's also not killed by just wiping your counter down with something. You got to use bleach. It's a little bit of a nasty actor. So it has a little bit of idiosyncrasies to it that some of the other viruses don't. But really, it's common sense stuff.
How do you pick these things up, Tony?
You usually pick them up. Viruses are almost always transmitted via person to person or surface to person, something like that. Some of them are food. Some of them could be foodborne. But usually they're transmitted from person to person or surface to person. They're what we call communicable, where, as I said, bacteria are a little less communicable via those routes. A big way with these viruses is airborne. You're in the room, somebody's coughing, and that you would be surprised how those microscopic particles that we can't even see with our eye, they go a long way. And depending on the ventilation in the room, what the air circulation is, right, the size of the room, the lowness of the ceiling, a lot of these things will determine just how communicable you are. So they're the major ways, though.
So a rule of thumb, if you're sort of like weak or sick, that you have some, the best bet is maybe not to go around people and stay indoors, etc.
Especially this time of year. Absolutely, yep.
What would be like? All right, if you didn't get the flu shot and you start feeling lousy, okay, what would be some of the treatments like?
Well, the first thing to do is something that you can obviously always do are some little at-home things. They always say drink a lot of fluids, which is always good. You want to stay hydrated. That helps you fight off illnesses. It's just good for you in general. You can certainly take some over-the-counter medications for fever or whatever. Be careful which one you take if you're on other medications. So you might want to check with your healthcare provider, because even things like Tylenol or aspirin or ibuprofen can have interactions with some drugs that folks take. So you want to do those things. You want to get a lot of rest, stay in bed, stay away from people. Then the real question comes in is when you should seek additional medical care.
Right.
So, the rule of thumb is if you have something that is more ominous, i.e. you are coughing up really thick, ugly mucus, or there's blood in the mucus, or you have chest pain, or you're short of breath, right? Things like that can be signals that something more serious is wrong. That's something that I would seek medical care for relatively quickly. If stuff like that is not going on, I think you can usually sit tight and ride it out, realizing that these things typically don't go away in a day or two. These things
sometimes they last a week or two.
Absolutely, a week or 2 weeks is not uncommon. For a good viral infection, you can feel pretty lousy for at least a week or two, and sometimes things like a cough. Or sometimes people will actually get what's called costochondritis, which is an inflammation of the chest wall from coughing. And sometimes that pain in here, when you move or twist or turn, or that dry cough, that can even linger for weeks after that. We used to say around here, people won't stop coughing until the humidity goes up in the air around May. And it happens sometimes. So some of that stuff will linger even more. But really, sit tight. As long as you're doing okay, you're not getting worse, a week or two is not uncommon.
Wouldn't you think that as soon as you begin to get these symptoms, okay, it'd be best that you call your healthcare provider? I mean, just to let them, this is starting, instead of waiting, until it really gets to a situation.
It can be, yes. I think it depends on the patient. I think if I'm an otherwise healthy 50-year-old person, I have no other underlying illnesses, I don't take a lot of medication, maybe I take something just for my cholesterol or something like that, I get what I think is a bad cold or a virus or something, I think I could probably sit tight without calling him. If I'm an 85-year-old person that has heart failure, COPD, yada, 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 I would probably let them know what's going on much earlier. I think that's...
Well, the reason I say that is you have Express Care.
Mm-hmm.
I mean, they're here, 24/7, and doesn't take that much as to go there and get checked out. I mean, play it safe,
Yeah, and Sam, that's a good. I mean, it's literally right out here.
Yeah, it's right out
on the
very
valley.
convenient.
The location of it is great. They're here 365 days a year, 8 to 8. The hours are great. The care is great. It's a convenient location right on the Beltway here, so it's easy to get to. So yeah, absolutely. In certain circumstances, that's probably your best bet.
Before we go to a quick break, give me again some of the suggestions we should have to sort of like prevent, coughs and colds. I mean, you don't have the magic wand, but give me some of the tips.
All right. I think number one is be cognizant of when you're sick and when other people are sick and steer clear. I think that's the first thing. A lot of hand hygiene. Try to stay clear of crowds if you can. Certainly if you have underlying diseases, do that. I think some people with the right underlying diseases with concomitant advanced age should mask. I think it's very reasonable for them to do that. If they do have to go out or do have to be around people, I think in that population, a mask is certainly reasonable. I think if you're in your house and somebody has an illness and you can't necessarily get away from them as far as the building goes, I certainly would try to quarantine them to one side of the home or a bedroom or something. Try to keep your distance. It doesn't do any good if everybody in the house gets sick, right?
Yeah,
so I think a lot of it is common sense. Keeping surfaces clean, just watching where you are, what you do, that type of thing.
Staying hydrated is something that's very important.
Absolutely, and that goes no matter what time of year. I mean, hydration is important, and we probably do a fairly poor job of that as a society as a whole. We drink a lot of caffeinated beverages that kind of make us lose more water than we keep in. So,
folks, I'm talking to Dr. Anthony Valente, no stranger to the area, Chief Medical Officer here at the Hazleton Hospital. We'll be back right after this. Well, welcome back to Your Health Partner, brought to you by Lehigh Valley Hospital Hazleton. My guest today is Dr. Anthony Valente, who is the Chief Medical Officer, talking about these terrible illnesses and viruses. If you just tuned in, we show this show a number of times, or go to our website or our YouTube channel. Anthony, we're talking about, before we get into the surveys, why they're important, when should someone go to the emergency room versus express care? Well,
Sam, I'm not sure there's an actual line, that we can say, well, this is definitely express care, this is definitely ED. I would say some general guidelines are if people are acting inappropriately, the mental status changes. If people have, now these are just guidelines, I'm giving you generalizations, certain things that we can just say, that would be one. Chest pain. I think chest pain will always require a decent workup, especially in, again, an advanced age person, somebody with underlying illnesses, somebody with known cardiac disease, somebody that's having difficulty breathing. That should almost always go to the emergency room. Somebody that is unconscious, obviously, right? Anybody that has a lot of underlying diseases, if they feel ill enough, in other words, if it's just not a sprain or a strain or something like that, those folks I would play it safe and go to the ED. The resources in the ED are obviously much better. It's much more staffed 24/7. And so there's different levels of monitoring in the ED that are not available in an express care. So I think those generalizations are pretty good. But again, I hate to say, look, if you have this, go here, if you have this, go there, because there's a lot of gray zones. But I will say, if you're at all questionable, or if you don't know where to go, go where your gut tells you to go. right? I think if you feel poorly enough, play it safe, go to the ED.
People get surveys, okay, the patient surveys. How important are they?
They're very important. Remember, myself, the rest of the administrative team, we can't be everywhere all the time, and we can't talk to all patients all the time. But just like any other entity, when you buy a new car, when you get your car serviced or whatever, we all want to know how we're doing, and we all want to know how we can make things better. And the only way we can know how to make things better is to know how we've done. And sometimes we've done very, very well, and sometimes we haven't. And if we haven't, we have to own up to that. We have to own that we didn't do something right? And the only way we're going to know that is if you tell us. So it doesn't do any good to have a bad experience and just go out and tell everybody else, I had a bad experience, but don't tell the people that really need to know that. So please, if you've had a bad experience, let us know. If you had a good experience, let us know, because we need to know that too.
Yes.
But certainly we can't fix something if we don't know it's broke. And I can assure you, we are striving to treat everybody with exceptional medical care. And if we're not, we're doing something wrong and we need to fix it. And so please let us know that that's happening.
Well, that's you're so right. You know, it says sometimes people don't want to tell you, but when you get a survey, fill it out.
Fill it out, let us know. And as I said, don't be afraid to tell us when we did something really good, and don't be afraid to tell us if we've done something wrong.
Tony, nice seeing you. Come back again sometime.
We'll do.
Okay.
Anytime.
Dr. Anthony Valente, my friend, no stranger to the area, Chief Medical Officer. Once again, your health partner, Lehigh Valley Hospital Hazleton, is there for you. We'll see you next time.